I'm Carolyn Rogers-Vizena from Boston Children's Hospital, and I'm excited to discuss our upcoming publication that looks at risk factors for hematoma after breast reduction surgery. Breast reduction is one of the most common operations that we perform in plastic surgery, but like any operation, it has potential complications, one of the most serious of which is hematoma. In this study, we looked at over 1,700 young women who underwent bilateral breast reduction to identify factors associated with developing a postoperative hematoma. These women were operated on using a variety of techniques: inferior versus superior medial pedicle, Wise pattern versus vertical skin excision, and electrocautery versus sharp technique for parenchymal excision. Using multivariate logistic regression, we analyzed a variety of patient and perioperative factors to identify those that are associated with hematoma. We found that most patient factors were not associated with hematoma, including BMI, size of the resection, race and ethnicity, and more. When looking at other perioperative factors, surgical technique was not associated with hematoma formation, but a surprising finding was that the use of Toradol was significantly associated with hematoma formation with an odds ratio of 3.93. Finally, a major point of interest when we designed this study was blood pressure during and after surgery. We found that when controlling for preoperative blood pressure, those patients who developed a hematoma had significantly higher peak intraoperative MAP and systolic pressure, and that as peak intraoperative pressure increased, as you can see in this figure, the odds of hematoma increased in a multiplicative fashion. We found a similar but even more dramatic effect postoperatively, where peak MAP, peak systolic blood pressure, and greater blood pressure variability were all significantly associated with hematoma formation. So, what are the take-home points of this study? Well, for one thing, the various surgical techniques commonly employed for breast reduction are all safe. We were surprised to find out that Toradol increased the odds of hematoma, which is an unexpected finding because there's also existing literature that suggests Toradol is not associated with postoperative bleeding. In terms of how this changes clinical practice, we don't necessarily advocate for avoiding Toradol altogether because it is a potent non-narcotic analgesic, but we have increased our use of TXA in an attempt to mitigate risk and have heightened awareness in patients who do have other risk factors. Our most striking finding was around the effect of intraoperative and postoperative blood pressure. For one thing, it caused us to reevaluate this practice of intentionally elevating blood pressure during surgery to look for bleeding. It also increased our awareness of who's at risk for hematoma. Considering that breast reduction is largely an outpatient operation, knowing who is at risk can inform how patients are educated to monitor themselves postoperatively and who might be at enough risk to either warrant an overnight stay or an earlier clinic follow-up.